Number one is it actually makes working in our hospital safer. We really believe that, and that was actually the first reason why we were thinking about Cubex or a solution. And then secondarily, we also know that from a charge capture perspective, economically, it makes sense. We've actually proven internally with our own finance people that it is actually accretive, even though it's a cost for Cubex. Just injectables on the treatment floor, we've proven through data that it's actually accretive to the business to have it.
I kind of took the numbers, put this case study together. Here we started with North Windham. North Windham showed that the Cubex managed treatment injectable revenue increased 45%. Practice revenue at North Windham and the visits actually declined. So the visits, based on that PIMS data, was down 4%. The practice revenue was down similarly. Your Cubex SKUs are up, but the rest is down. So that just, I think, was a good call out. This is looking at average revenue per month at North Windham, and so for those treatment injectables, went from 5,600 to about 8,100 in average revenue per month, and that is going to more than offset the subscription cost. And at Aspetuck, we saw the similar revenue increase across treatment injectables, same kind of trend in visits, a little bit steeper decline in visits, but we'll start with the revenue. We saw a 40% lift in the revenue comparing the prior year period to the current year period, and I did the same compare to validate the numbers there. And then we saw a 6% decline in visits. So again, if you would, in normal comparison, would be, well, then that revenue probably should have gone down, but instead it went the other way. Yeah. So pretty compelling stories when you consider that they're both seeing similar directional trends. And it's a really strong story from my perspective.
When it comes to money, it's that's one of the big ones we always hear is ultimately it costs more money. I'm not spending the money today, but what we've been able to prove is it actually adds to your profitability in addition to keeping the team safer. In the hospitals we have deployed Cubex, we know that it actually is impacting the business in a very positive way, which is why we're focused in the future about rolling out Cubex to more of our hospitals.
Nothing can be taken out without it actually going through the patient visit list or being on the invoice. So every one of those is accounted for.
Definitely helps me sleep better at night is that fewer mistakes are made because there's a lock. You can only take this one certain thing out when it opens up. The partnership with Cubex and Rarebreed is that if you're focusing on the employees, you want to make their job as easy as possible. And so Rarebreed's always looking for the next best technology to try and make things better, quicker, easier, less burdensome to the staff. And so I think that that's where this partnership works well.
If my controlled drug inventory manager is able to save even 15 minutes a day or an hour a week, now they're able to do something else. We can see another 1 or 2 technician visits. We can see another appointment, or we can handle some phone calls that came in from clients. And so it just frees them up to do other things.
I'm Laura, and I'm a technician at Aspetuck Animal Hospital.
When I asked her about what she felt about Cubex, the first thing all she could say was like, "It's awesome."
I have more time to do literally everything else.
Helping the employees do their best work for the patients and the clients is really the goal.
It definitely saves time and money in the end.
The idea of helping staff and keeping them doing what they want to do, taking care of the patients and not spending hours doing drug logs and reporting and things like that.
Cubex is awesome.